The United States National Institute of Health has lifted its ban on funding HIV and TB research in South Africa. According to some South African health researchers, many of the world's major advances over the past 2 decades in understanding the science of HIV arose from South African scientists and from studies conducted here, the vast majority of them funded by the NIH. Director of the Infectious Diseases and Oncology Research Institute at Wits University, Professor Glenda Gray, joins us now for more on this. Prof, good evening. Thank you so much for your time. Really do appreciate it. How important a U-turn is this by the US?
This is an incredible U-turn, and it's something that we greatly need. South Africa needs this kind of research endeavor, and I think that having the NIH return back to South Africa is very good for both the US and for South Africa.
Is there worries, at least on part of South African researchers and research institutions, that this funding might abruptly come to an end once again?
Well, we hope that the US sees the importance of South Africa's contribution to global health security and for the health of the US citizens. We do know that research done in South Africa has great impact both in our country and abroad, and including America. So the kind of research that we can conduct in South Africa in HIV and TB has global importance. And any child or any outcome in South Africa will improve the outcomes of people in the US as well. We can do research so much better in South Africa. We have a wonderful infrastructure, as well as the ability to answer questions much quicker and more affordably than anywhere else in the world.
Yeah. Importantly, Prof, what has happened to HIV and AIDS research in the last year or two when the funding came to an end abruptly?
Initially, it was quite catastrophic, and a lot of our research centers had to retrench people, so we were unable to sustain the staff and the infrastructure. But fortunately, our government understood the importance of health research in our country, and together with Wellcome and Gates Foundation, put together a relief fund to help support the kind of work that we do in South Africa. So this funding that came from the South African Medical Research Council helped bridge the gap between the funding that we didn't have to keep doctors and nurses and scientists in the lab going while we try to look for other funding.
Yeah, let's talk about some of the important research that's currently underway in South Africa. Of course, you know, the rollout of lenacapavir is an important milestone in the advancements of HIV prevention research in South Africa. But what other research projects and or research questions are currently top of mind for industry leaders like yourself?
So what's important is obviously HIV vaccine research remains top and paramount. At a global level, we need an HIV vaccine. Also, we're also working on interventions to address HIV cure or functional cures. So only South Africa can answer the question about what we need to do in terms of remission, or put people who are living with HIV for a remission or a cure. So I think it's important that that's important, as well as TB vaccines. We're doing a big TB vaccine trial in South Africa, and hopefully this TB vaccine, if it works, we'll be able to roll it out globally. So both TB vaccines, HIV vaccines, and interventions to look at cure are important for South Africa and the world.
Yeah, and just lastly, how much is truly needed for the undertaking of HIV research in South Africa?
Well, the kind of investment that we see at a global level is more than R1 billion a year. And this is very important because it basically helps us sustain the laboratory infrastructure as well as the clinical infrastructure. And this kind of investment also builds early stage investigators. It builds the next generation of leaders in science and keeps a whole ecosystem of science together that's dearly needed in a country that's really badly affected by both HIV and TB.
Yeah, Prof, thank you so much for your time on this. Really do appreciate it. That is Professor Glenda Gray, the Director of the Infectious Diseases and Oncology Research Institute at the University of the Witwatersrand.